I was scheduled to have my second dose of Moderna vaccine on a Saturday. Because many of my colleagues had severe flu-like symptoms for about 2 days after the second shot, I decided to get my second shot at noon on Friday, which was one day ahead of the schedule. Since the side effects commonly started 4 to 5 hours after the shot, I figured that if I had the shot at noon, I would still be able to take care of my patients in the afternoon. When I did start to experience the discomforts, I would be at home resting and I would have 2.5 days of rest during the weekend to recuperate. Since the COVID vaccine was known to cause arm pain, I chose my right arm for the second shot because I sleep on my left side. The second shot was painless. I did not feel any discomfort until about 4 hours later, when I started to notice a dull pain at the site of the injection, and the pain got worse gradually. I had to use my left hand to eat dinner and to brush my teeth because I had difficulty raising my right arm due to the severe pain. When I was ready to go to bed about 12 hours after the second shot, I started to have generalized muscle aches and headaches. I also felt feverish with sweating. The symptoms got worse as the night went on. I was unable to fall asleep due to progressively worse headaches, body and muscle aches. I also had profuse sweating. I almost fell when I went to the restroom in the middle of the night. It was a long and sleepless night. I felt my heart rate was about 10 beats faster than usual. I did not bother to check my temperature because I did not want to disturb my family, but I estimated that my temperature was about 2 degrees Fahrenheit higher than normal because an increase of body temperature by 1 degree centigrade can raise heart rate by 10 beats per minute. Before the COVID vaccine shot, I did not take acetaminophen or ibuprofen for preemptive control of the side effects. Studies have shown that taking analgesics like these before the vaccination can reduce antibody production. Despite the discomfort, I decided not to take ibuprofen or naproxen for relief because taking ibuprofen or naproxen in a stressful situation can increase the risk of stomach bleeding and acute kidney injury. While awake in bed, I began to sort out the events of the COVID pandemic in the past year. The first COVID case in the United States was confirmed in January 2020, and since then, the management of COVID-19 has been evolving. Treatment with medications such as hydroxychloroquine with azithromycin, remdesivir, convalescent plasma, dexamethasone, and monoclonal antibodies has caught attention at different periods of time last year. Hydroxychloroquine and azithromycin are no longer recommended for COVID-19 treatment. Recommendations against wearing a mask for the general population transformed into mandatory mask wearing in many places. Then came the exciting news of the emergency use authorization by FDA of the mRNA vaccines manufactured by Moderna and Pfizer-BioNTech in December 2020. Here, I would like to briefly discuss the concept of mRNA vaccines. The mRNAs in the vaccines coat the spike protein on the surface of coronavirus. The mRNAs are synthesized in laboratories. They are packaged in lipid nanoparticles to make the vaccines. After the mRNA vaccine is injected, the mRNAs enter the human cells, which produce the spike proteins. The human immune system is stimulated by the spike proteins and generates specific antibodies that neutralize the COVID-19 virus to prevent infection. A second vaccine shot boosts the efficacy of the immunity against COVID-19 to about 95%. I would like to clarify that mRNA vaccines do not contain the live coronavirus or cause COVID-19 infection, nor do they lead to human genetic mutation. Finally, Saturday morning arrived. I estimated that I had a fluid deficit of about 2 liters due to sweating and body fluid redistribution. I slowly went downstairs and drank 1 liter of water mixed with half a teaspoon of baking soda because I knew I also needed some sodium and alkali supplement. Although I had no appetite, I forced myself to eat 1 banana in order to supply my body with some sugar and potassium. Throughout the day, I had to lie in bed due to persistent headaches, muscle and body aches, and generalized fatigue. With my first-hand experience of uncomfortable pain, I had a greater understanding of the sufferings of many patients in my practice now. In the evening, all of my symptoms had improved. I walked half a mile outside before bedtime to minimize the risk of developing blood clots. With a good night of sleep Saturday night, most of my symptoms other than fatigue and arm pain went away by Sunday morning. On Monday, I was back to normal and went to work as usual. Many people experience worse side effects from the second COVID vaccine shot. Here are my suggestions for coping with the side effects from the second vaccination. Plan to take 1 to 2 days off work after the second shot. Avoid taking acetaminophen, ibuprofen, or naproxen before the COVID vaccine shot because these medications may reduce antibody production. Try not to take naproxen or ibuprofen for pain or fever if possible to avoid stomach bleeding or kidney damage. If you have high blood pressure, check your blood pressure frequently to make sure that your blood pressure is within the normal range. For people with diabetes, check your sugar frequently. Call your physician if you need to adjust your medications in case of blood sugar fluctuation. Make sure you drink enough fluid to avoid dehydration. Also, keep the floor at home free from clutters and maintain adequate lighting at night to prevent falls. If you continue to have fever, chills, headache, muscle aches after 3 days, you should contact your physician to make sure you're not getting COVID infection. So far, over 38 million doses of mRNA vaccines have been administered in the United States. People will obtain full immunity against COVID-19 infection 1 to 2 weeks after the second shot. Please keep in mind, though, that even a complete vaccination may not prevent you from carrying the virus and giving the virus to unvaccinated people. The efficacy of the mRNA vaccines is about 95%, and there is still a 5% chance that fully vaccinated people can contract COVID-19. In addition, the mutated COVID-19 variants have started to spread in the United States. The mutated COVID-19 virus can partially escape from the immunity induced by current vaccines. So even after the second immunization, we still need to wear a mask, keep social distancing, and wash hands frequently. Before I conclude the video, I would like to share with you a short piece of music named Hope. It was composed by my cousin Ronghua, and he will be playing his piece with his own handmade musical instrument called the xun.